The White House estimates that as many as 100 million more COVID cases in Americans will occur this fall and winter. The projection comes as the UN announced 2 new subvariants of Omicron, but health experts say there are reasons for optimism. In San Diego County, the number of COVID patients in the ICU is at the lowest point we've seen since the start of the pandemic. Just 2.2% of our ICU beds are devoted to COVID patients, but health experts aren't celebrating.
We do appear to be entering another phase of this pandemic where vaccinated people with strong immune systems are experiencing milder illness. But cases are going up again. People are still dying of COVID, and we can't rule out the possibility of a major wave in the coming months.
The White House projects up to 30% of the U.S. population could be infected this fall and winter, about 100 million new infections, as the Biden administration pushes Congress for additional funding. For context, about 80 million Americans were infected during the Omicron wave from December through January. Health experts say a surge like that would cause more hospitalizations, but likely not at the same rate we saw earlier in the pandemic.
The average case of COVID-19 does seem to be getting milder, but this is probably more because we as a population are building up immunity, not because the variants are necessarily getting milder on their own.
Still, Dr. David Dowdy of Johns Hopkins says Omicron subvariants remain dangerous for the unvaccinated and people with weakened immune systems. This CDC map shows community spread remains low right now, but COVID is still projected to be the 5th leading cause of death in the country this week, and the U.S. will soon eclipse 1 million COVID deaths since the pandemic began. Meantime, South Africa might offer a clue about what's to come. The World Health Organization says 2 new elusive subvariants have been detected there.
We are now starting to see an increase in the proportion of sequences reported of BA.4 and BA.5 in South Africa.
South Africa is seeing a big spike in cases from the subvariants, including reinfections in people who had Omicron before, although hospitalizations remain relatively low, and health experts are crediting vaccinations. Both Pfizer and Moderna are working on updated vaccines, which they hope to release by fall. The White House projects that widespread adoption of those shots or improved uptake of our existing boosters would keep the death rate to less than 0.1% among those who get infected. Otherwise, they say we could see hundreds of thousands of additional deaths this winter and fall.